Welcome to SST College of Arts and Commerce. This is SST Edupedia. We are going to see health, fitness and disease for FYBAF, FYBMS, FYBCBI and FYBCom of semester 2 in Foundation Course Physical Education 2. Myself, Assistant Professor Mithili Gaurishankar, going to teach you today this topic. This is the module 2. In this, definition of obesity and its management, communicable diseases, their preventive and therapeutic aspects, factor responsible for communicable diseases, preventive and therapeutic aspects of communicable and non-communicable diseases are the topics we are going to cover. In this, two topics already recorded in before video. Now again, communicable diseases. These diseases that spread from one person to another through a variety of methods. That is socio-economic, environmental and behavior factor as well as international travel and migration foster and increase the spread of communicable diseases. Who are having the disease which can be spread? That is the communicable spreadable agents. So, maintaining the distance and taking precaution to avoid the disease spreading to others, and also recipient who is having less immune getting the communicable diseases should be take precaution to avoid infecting by the disease. So communicable diseases, last 3 years we are facing COVID, that is also one of the communicable disease. We have taken many precautions to avoid spreading. Factors responsible for communicable diseases are, there are some key risks for communicable diseases identified in the academic literature can be broadly grouped into categories. The communicable diseases can be spread through water, sanitation and hygiene, health and public health system, environmental, humanitarian response, infrastructure insecurity, living conditions, nutrition and mass population. And also one individual immune system also should be have strong for not getting infected. So these are the factors responsible for spreading of communicable diseases. Other spreading continuous cycle we are having, the infectious agent gives it to reservoir, through route of exit, mode of transmission will be there, route of entry, susceptible host is there, again it will go to infectious agents. This is the cycle of factors responsible for communicable diseases. Next we are going to see non-communicable diseases. The disease which cannot be spread through general communication is called non-communicable diseases. The non-communicable diseases are diseases that are not spread through infection or through other people but are typically caused by unhealthy behavior. This is related to one personal habits. 4 types of non-communicable diseases account for over 3/3 of deaths globally are cardiovascular disease, cancer, diabetes, chronic respiratory disease. In this diagram we are seeing here some of the risk factors are alcohol abuse, physical inactivity, smoking, unhealthy diets. These will give the result of many non-communicable disease. It was given like a plant. Chronic respiratory disease, cardiovascular disease, diabetes, cancer and other non-communicable diseases are possible due to the risk factors given here. Non-communicable disease include these 4, and a risk factor that leads against some of the diseases are high blood pressure, physical inactivity, obesity, raised cholesterol, decreased vegetable and fruit intake, raised blood glucose, alcohol consumption, tobacco use. These are the risk factors of non-communicable diseases. List of non-communicable disease we have already seen. We are seeing in that some branches. Cardiovascular diseases means stroke, heart attack, peripheral artery diseases, PAD we used to say, coronary artery disease, deep vein thrombosis, congenital heart disease, etc. The disease related to heart are cardiovascular diseases. Respiratory diseases are asthma, pulmonary hypertension, chronic obstructive pulmonary disease, occupational lung diseases. These are related to respiratory diseases. And diabetes, we are having types, type 1 diabetic, type 2 diabetic, and gestational diabetics also there. Cancer, there are many types of cancer is there: skin cancer, leukemia, prostate cancer, lung cancer, breast cancer, gastric carcinoma, cervical cancer, bladder cancer, etc. Other non-communicable diseases are rheumatoid arthritis, neurodegenerative diseases, osteoporosis, obesity, depression, hypertension, cataracts, cognitive impairments, chronic kidney diseases, etc. These are comes under non-communicable diseases. What is the prevention and control of non-communicable diseases? One, individually doing the prevention control will help not having any non-communicable diseases. An important way to control NCDs, this is the short form of non-communicable diseases, is to focus on reducing the risk factor associated with these diseases. Low cost solution exists for governments and other stakeholders to reduce the common modifiable risk factors. Monitoring progress and trends of NCDs and their risk is important for guiding policies and priorities. Management of NCD includes detecting, screening and treating these diseases and providing access to palliative care for people in need. So emotional help who are infected is also need for prevention and control. High impact essential NCD intervention can be delivered through a primary health care approach to strengthen early detection and timely treatment. Early detection of non-communicable diseases and timely treatment, taking the medicine with the consult of doctor is the one of the prevention. Evidence shows such intervention are excellent economic investment because if provided early to person, they can reduce the need for more expensive treatment. So in corona time also, vaccination made compulsory for avoiding the spread. This is one of the prevention taken. Countries with inadequate health care coverage are unlikely to provide universal access to essential NCD interventions. So medical equipment less countries will have the detection poor, so that the spreading of the diseases and also not having awareness of hygiene and other prevention makes the spreading of NCD diseases. NCD management interventions are essential for achieving the SDG target on NCDs. The target of precautioning the disease and creating awareness among the people are also important in NCD control. The four key components of the response of NCDs are tobacco use, physical inactivity, the harmful use of alcohol and unhealthy diets all increase the risk of dying from an NCD. Detection, screening and treatment of NCD as well as palliative care are key components of the response to NCDs. In prevention and control, we want to keep in one main thing, that no treatment options that lead to curing a non-communicable disease from our body. Instead, The doctor may prescribe medicines and recommend lifestyle changes to improve your symptoms. Some of the diseases like cancer, early stage noting is important and continuous treatment is important to get the more effect of the disease. Neglected non-communicable diseases may increases in many other diseases to possible to come inside the body. So these are the percentage given: 11.8% of CVD, 7.6 of neoplasm, 3.10 of COPD, diabetes is 1.90. These are big 4 NCDs. Neglected NCDs, which is not knowing the awareness and getting the problem, are other neglected NCDs: alcohol and substance abuse, liver cirrhosis, asthma, chronic kidney diseases, Alzheimer and other dementias, and skin related problems. These are the things which are getting through the neglected basis. These are non-communicable diseases. Modified behavior risk factors are using tobacco and other factors we have seen. Tobacco account for over 8 million deaths every year. These are the reports we are having due to the risk factors. 1.8 million annual deaths have been attributed to excess salt and iodine intake. More than half of the 3 million annual deaths attributed to alcohol use. 8,30,000 deaths annually can be contributed to insufficient physical activity. These are modifiable behavioral risk factors. Metabolic risk factors having 4 main issues: raised blood pressures, overweight, obesity, hyperglycemia and hyperlipidemia. These are the things happening as non-communicable diseases. Till this we have seen communicable, non-communicable diseases and also about obesity in this module. Thank you, students.